So knee malalignment is a really broad category. It means anytime that your knee angle, meaning going from your hip to your knee to your ankle, is not as straight as what we would usually expect. It can happen for a lot of reasons. It can be something that you're born with. It can happen from trauma. It can happen over time with deformity like arthritis, or it can be the result of a surgery. So a knee malalignment is whenever you're looking at someone who's standing in front of you, and the most common way it's typically described as somebody that's got either a bow leg or a knock knee. So that knee is going to be either closer to the other knee than it's supposed to be, or further away from the knee than it's supposed to be. It's common to have some variance. Everybody's got a little bit different anatomy. So no people are going to have the exact same angle. So no two people have the exact same angle. Whenever we look at the malalignment, mostly what we're worried about is this affecting your quality of life? Is this affecting your function? Is it causing other problems? Someone who has a knee malalignment, in most cases, that's not causing pain, not affecting their quality of life, that's not somebody who needs to rush off and get that taken care of. But if you're somebody who has a knee malalignment, whether it's at a really early age, whether it's right in the prime of your life, whether it's later in life, if it's affecting you, it can affect your hip, back, ankle, certainly can affect pain around the knee joint itself, then that's something that needs to be addressed and evaluated. So the causes of the deformities are really wide and not something that I would get too nitty-gritty in terms of detail because it's just too broad to discuss. The major categories of knee malalignment are going to be ones that you're born with. They're going to be ones that are acquired over time because of either genetics or activities, things like that. It'll be related to another disease process. It can be related to a previous surgery that you may have had, or it can be related to a trauma. Certainly still other categories, but those would be your major group. So the treatment options for knee malalignment are going to mostly focus on what kind of surgery it requires and what's the cause of the problem. The most common categories of knee malalignment will be at a younger age, when we're going to do everything we can to save the knee. So that would be things like an osteotomy, which means we're actually breaking the bone and correcting it, allowing it to heal. At an advanced age, that's typically going to be doing an arthritis type surgery or a replacement type procedure. And during those replacements, we can straighten that knee out. So if you're bow-legged or knock-kneed because you've got arthritis, we can correct that with a surgery. If it's because of a previous surgery or because of wear and tear after a previous surgery, again, that's something we can correct. We refer to that as a revision surgery. Again, there's a lot of complexity in terms of what the previous problem is, how extensive the surgery is that's going to affect what the recovery process is going to be. So something you need to discuss with your surgeon, but for a lot of these, it can be a relatively rapid recovery, meaning 2 to 3 months. But a lot of the longer recoveries are going to be something where there's a more extensive, more severe problem going on. So something you need to evaluate and make sure you have a good, comfortable relationship with your surgeon before you dive into a surgery. Whenever you read online about a knee deformity or knee malalignment, the two main terms you're going to see are varus and valgus. Obviously not something I expect the patient to understand. The way that most folks will describe it is a knock knee, was whenever you have the knee that's going medial, so towards the middle, towards the other knee, and that would be a valgus knee. Whenever you have a bow leg, which is more common, then that's going to be somebody that has a varus knee. There's a lot of different things that can cause both of those things. As a knee replacement specialist, the most common time I'm going to see it is whenever that comes from arthritis, which is incredibly common. The more common way we're going to see that is with the bow leg. You can certainly get a knock knee. Sometimes you'll get one knee that's a knock knee, one knee's a bow leg, which we commonly refer to as a wind-swept deformity, meaning that both knees are pointed the same way. It's like the wind's going to blow you over. So whenever we look at those two problems, very different approaches that we use in the operating room, still things that we can correct. The more severe they are, the harder they are to fix, as you would expect. But certainly, again, something you need to make sure you have a conversation with your surgeon about the details of those things, how that's going to affect recovery, so that way you know what to expect after surgery.